What is considered a normal range of respiratory rate for an adult patient at rest? So there's different things we want to underline here. So respiratory rate, this is defined by how many breaths a person will take per minute. So we could calculate that on a patient if we try and count how many times the chest rises and falls within 1 minute. You could also do it over the course of 30 seconds and multiply by 2, unless you think there's any reason that it could be abnormal, such as in an infant, you would want to count for the full minute because it could be irregular. Also, we want to note here that it's an adult age person because respiratory rate could vary by different age range. So we know adult. And then at rest, this is important to note because if the patient or the person had just been exercising or they're very nervous, this rate could be increased and that could still be considered normal based on the conditions. But we know that this person is at rest. So when we see all these ranges, if you forgot offhand what the normal range is for a regular adult patient at rest, let's see if there's any that we can know to eliminate right away. So if we look at option A, 5 to 10 breaths per minute, that would be very low. If a person is only breathing 5 to 10 times, that's almost half or less than half of what they should be breathing in a minute. So we could eliminate that. That would be considered what we call bradypnea. Brady is a prefix for something that's low or slow, and then apnea, that has to do with respirations, such as bradycardia would be a low heart rate. Now, on the other end of that, if you see 25 to 30 breaths per minute, for an adult age person, that would be very high, especially if they're at rest. There's no reason they should be breathing that quickly if they're just resting and there's no apparent reason for why it's so fast. This could mean that there's some sort of other issue going on that needs to be investigated. So we can eliminate that. That's very high. That would be the opposite of bradypnea, tachypnea. Tachy, meaning fast, and then apnea is the prefix for respirations. Similarly, tachycardia would be a very fast heart rate. Now we have eliminated those two options, and we are between options B and C, 10 to 14 or 12 to 20. And this could vary person to person, but the generally accepted respiratory rate that's normal for an adult age patient would be 12 to 20 breaths per minute. That would be the normal standard textbook rate of respirations for an adult age patient. So option C. Option B is 10 to 14, so that's on the lower end. The 14 still could be within this range 12 to 20, and for some people, maybe that's normal for them, but typically 12 to 20 is the acceptable average respiration rate for an adult patient at rest.